Welcome back to the channel. Today we're about to be reacting to a video that's based on a touchy subject. The video is titled Black Women with HIV. Now I know that this isn't often talked about, and I think it should be. So please bear with me. If there's any comments that you have in the comment section, please be serious. Leave all questions down below if you don't understand. Maybe somebody get to them that is going through it, or maybe someone that knows someone that's going through it, and they'll be able to, answer your questions. But as always, don't forget to like, share, watch more videos, and subscribe to the channel.
Welcome and thank you for joining us. I'm Deborah Levine, Senior Director of Love Heals Youth Education Program at ACREA. Founded in 1991, ACREA works to improve the lives and transform communities through research, education, and advocacy in the hope of achieving a world without AIDS. I also serve as the non-clinical co-chair of the New York City Department of Health's New York Knows HIV Testing Initiative. Today, I have the pleasure of introducing to you three dynamic women who have devoted much of their life's work to HIV prevention, treatment, and care. Our discussion will focus on the impact of HIV on African American women, and including women over the age of 50, who are often forgotten in this conversation about HIV and AIDS. The month of March is significant to women for two reasons: Women's History Month and the National Women's and Girls HIV/AIDS Awareness Day, which is observed on March 10th every year.
If these type of videos interest you, let me know in the comments and I'll be sure to post more.
The month of March also marks the launch of ACREA's major campaign, I Am My Sister's Keeper, which is designed to raise awareness about the ongoing crisis of HIV and AIDS among Black women, especially women over the age of 50. We are honored to have the support of ACREA's brand new Goodwill Ambassador, music legend, and longtime AIDS activist, Dionne Warwick, who is featured in 3 new informational public service announcements produced by ACREA for the launch of their new campaign. Here to join me in discussing topics related to the impact on Black women are my guests, Kim Kennedy, Denise Drayton, and Dr. Alicia Leggett. Kim Kennedy is a noted youth advocate, an AIDS activist, and a longtime member of the ACREA Love Heals Speakers Bureau. A Brooklyn native, Kim's learned that she was HIV positive at the age of 10 after both of her parents died from AIDS-related illnesses. Next to her is Denise Drayton, who has been working in the HIV field for over 20 years. She's the former chair of the New York Presbyterian Hospital's Consumer Advisory Board, and she currently serves as a community liaison for ACREA. A proud mother of 2 and a grandmother of 2, Ms. Drayton has been living with HIV since 1993. Next to her is Dr. Alicia Leggett, who's a physician who specializes in family medicine. She completed her medical training at the University of Maryland School of Medicine and has completed her residency and HIV primary care fellowship at the Family and Social Medical Residency Program at Montefiore Hospital in the Bronx. Dr. Liggett currently serves as the Director of the Pediatric and Family Care Services at Harlem United, a New York City-based not-for-profit organization. Ladies, welcome. Before we begin our discussion, let's take a look at Ms. Warwick's new PSA.
People with AIDS are people, they are families, they are mothers, fathers, sisters, brothers, aunts, uncles, friends, neighbors, just people. But if through my work I am able to save one life, to bring one family closer together in their time of need, then I will consider my work well done.
You know, despite remarkable progress in the fight against HIV, women account for almost 20% of the estimated 45,000 new HIV infections in the United States each year. African American women account for an alarming 62% of new HIV infections. We must continue to protect ourselves. If you are sexually active, no matter what your age, please practice safer sex and get tested for HIV. To get the facts about HIV, visit ageisnotacondom.org.
Dr. Liggett, almost 40 years into this HIV epidemic, there's still so much that people don't know or don't understand about the transmission of HIV. And especially Black women and women over the age of 50. Can you tell us a little more about how transmission happens and what that means?
Absolutely. First, I'd like to start by just saying thank you for having me today, Deborah. It's such a privilege to be here to speak to you and all of you out there about HIV. So HIV is transmitted primarily three ways. It's usually transmitted through the exchange of blood or bodily fluids between individuals. In the vast majority of cases, people contract HIV through sexual contact with other individuals who are infected with HIV. In many cases, people don't know that they're carrying the virus when they have sex with someone and pass it on to that person. Additionally, people can be born with HIV, and the virus can be transmitted from mother to child. In these cases where HIV is transmitted from the mother to the child, in most cases the mother has not been on proper treatment to be able to suppress the virus to prevent the transmission to her child. In 2017, we have such excellent medications now that women who are on treatment and who remain virally suppressed, meaning that there's no viral replication in their blood, have a very slim chance of passing the virus to their child, which is excellent. We know that in 2016, there were actually no new cases of babies born with HIV in New York State, which is amazing.
That's
as a result of
amazing.
the wonderful work we've done
Yes.
around this issue. And then the third way is through blood transfusions, which is extremely rare in the United States, primarily due to the fact that we have a rigorous screening process for the blood products that people receive in the hospitals. The blood is tested for all sorts of infectious disease, including HIV, to ensure that when people do receive transfusions, that they don't receive any blood that has been contaminated with the HIV virus. So those are primarily the three ways that HIV is transmitted. So through sex, through mother to child transmission, and also through blood transfusions.
Now, I'm not gonna lie to you. I know we've come such a long way when it's talking about this subject since the '80s. But I'm gonna be honest with you, I thought it was a lot more than just three different ways of, attracting this illness. Let me know, did you know it was just those three ways?
Gotcha. That's very helpful. And so, what do you think, in your professional opinion, that Black women, the reason why the rates, although have gone down, but we're still disproportionately impacted? And what do you think that that's contributing?
Yeah, I feel like it's definitely a multifaceted issue that why it is that the HIV virus disproportionately affects people of color and among women, particularly women of color. Um, First is the issue of condom negotiation, and I know that we all hear so much about, you know, it's important to use condoms
Right.
and wear condoms, but I think really where the problem lies is that oftentimes women haven't had a truly in-depth conversation about their sexual and reproductive health, their sexuality, really starting at an age where they can really come of age and be comfortable enough to speak with their sexual partners about using condoms. It's one thing to just say use condoms, it's quite another to have a conversation with your sexual partner about that. I think also sometimes when people do bring it up, when they do have the strength to say, hey, let's use a condom while we're having sex, sometimes there can be an implication that that you don't trust the person because you're asking them to use condoms. So that can bring up all sorts of issues in the relationship that may bring discord in the relationship. And I think for many women of color who really kind of aspire to have healthy relationships, in particular with men of color, it can be a very sensitive issue to talk about. Using condoms, but also prevention of HIV, getting tested, and also knowing each other's status. So sometimes that can be really difficult for women to talk about. I think the other issue is that perhaps a lot of women aren't really aware of some of the other prevention modalities that we have available to us now in 2017 that we really didn't have even 5 years ago. One in particular is the pre-exposure prophylaxis or the HIV prevention pill that women can take every day to really prevent HIV. And this is really important for women who are in relationships with partners who they know are HIV, living with HIV, or women who just are having casual sex and want to have an extra layer of protection so that they themselves don't acquire HIV.
And that's also known as PrEP?
Yes, it's known
Okay.
as PrEP, yes. The other issue, which of course, ladies, you can jump in at any time, is stigma. It's really difficult, as I mentioned before, for women to kind of speak about HIV, speak about preventing HIV, and for those women who may already be living with HIV, difficult to disclose their status to their partners because there's just a lot of negative connotation around what living with HIV means, and I think that's just because a lot of people don't have a lot of knowledge about what it means to live with HIV. HIV is not the same disease that it was in 1980 when we first kind of learned about what this disease was. In 2017, it's really a chronic disease, meaning that it's a disease that people live with, and in many cases, people can live long and fruitful lives, and we know that their life expectancy is about equal to those people who are not living with HIV if they take care of themselves, they exercise, they eat well. That doesn't mean that they're not going to suffer from all the other chronic conditions that people who aren't living with HIV have, like diabetes and high blood pressure. But it does mean that they can live a long, fruitful life if they take care of themselves and if they take their medications. We also know that taking medications and really remaining virally suppressed, meaning that you don't have the virus replicating in your blood, means that it's a very slim chance that you can also pass it to other people. So it's very important to for women to kind of understand that as well.
And so, is there anything in particular about older women, more mature women, that puts them at risk for HIV?
Yeah, that's actually a very interesting question. I think specifically for older women, there's this issue of perceived risk, which means that these women often feel like they've reached a point in their lives where, they may not be having sex as often as they were when they were younger, and they don't perceive that they're actually at risk for getting HIV because of their age, because of their maturity. But really, everyone's at risk who's sexually active. And I think also the other issue is that providers often don't initiate that conversation during the physical examinations to really kind of probe into a woman's sexual and reproductive health and really ask her about the types of sexual behaviors that she's engaging in to really.
Let me know in the comments. Why do you think people are so afraid to have that type of conversation with their partner?
See if in fact this person is at risk and should be offered an HIV test. So I think it's really a two-pronged issue for older women in that they don't perceive that they're at risk, they don't perceive that they can actually get it because of their age, and also providers feeling very uncomfortable initiating conversations around sex with older women, also because of, in their mind, of lower perceived risk of infection as well.
So something like Miss Warwick's PSA that is really showing a woman of a certain age, really talking about sexual health, still being a sexual being, could really help women see themselves and be able to maybe begin to think about ways in which they can strike that conversation up.
Right, absolutely.
That's a really, thank you for taking the time to explain that to us and really sharing that perspective on how it's transmitted and what some of those issues are. I'd like to be able to include Denise in this conversation because I think it's critical. Denise, I recently read the transcript of an interview that you gave approximately about 10 years ago, in which you were quoted in saying, "I was an HIV outreach worker before I contracted it. I was in the field telling people about condoms, but not always practicing safe sex myself. People would say, but you're an AIDS educator. What happened? I contracted it from a person who did workshops on HIV prevention too. People think education has everything to do with it, but all the education in the world won't help unless you apply it. It's the human factor that prevents you from thinking about HIV in the heat of the moment. It's the whole notion of, it can't happen to me." So Denise, as a woman over 50, or somewhere in that range.
66.
Oh, all right, looking fabulous.
Okay.
Can you tell me what some of the challenges are for being positive and being over 50 and being fabulous as you are?
Thank you.
You know, the crazy thing about it is often we have or come across so many people that are like that. You know, they would teach one thing and then live a completely different way. You know, they don't practice what they preach. Let me know in the comments, have you come across something like that? And have you also um, lived that way? Not necessarily saying, you know, to the point where you're able to catch a disease. I mean, period. You know, where you practice one way or teach one way and live completely opposite.
I think right away, and thank you for allowing me to be a part of this panel. I think, thank you, Doctor, for the information. I agree with a lot of what you were saying, simply because I witnessed it. I'm a servant leader in church. I run the AIDS ministry at my church. And so I work with prime timers, or people that are older adults. And I think the notion also is, I had one woman say to me, well, you got to die from something. And I said, you don't have to die from HIV.
Right.
You know, but the attitude is, you know, if they're anything like my mom, it's the pill burden. They, you know, if you have to know that you're facing a lifetime of medication, at this point, I'm taking a 1-pill regimen since 2006. So, and prior to that, it was many pills. So it's the challenge of making sure that you are consistent with your treatment, that you're visiting your doctor regularly, you're taking care of your physical health, because there's other things that are going on for me. I also have high cholesterol, high blood pressure. So there's the additional illnesses that happen, or conditions that are coexisting with HIV in my body that I have to be extra careful about. I have to take my blood pressure medicine, I have to take my cholesterol medicine, I have to take my HIV meds. And so it's a physical challenge in as much as that I have to stay consistent, because pills don't work well if you don't take them. And if you don't take them at the right time, if you knock yourself off of a particular regimen, Sometimes it doesn't work as effectively, and you may ruin the chances of another pill that could work effectively for you because you were inconsistent in taking this one. So I have to be mindful of being on my meds, making sure I make my doctor's visits, gynecologist visits, because even though I hate to go to the gynecologist, you have to go because there are conditions that are specific to HIV, cervical cancer being one of those things that they check for, and you get your pap smear, you get your colonoscopy. There's things that have to be, you have to maintain yourself. So you have to treat yourself like a Cadillac and actually take good care of your physical health. You know, initially when I contracted HIV, I was very scared. The doctor that I met, he didn't explain the pills to me. He didn't let me know what the medication was for. I was frightened of it, and I didn't take them because I was witnessing people not looking too good, and I was afraid of the pill regimen that he put me on. He just gave me a paper and said, read about it. He didn't explain it to me. So subsequently, my T cells started to drop, and I just took a leap of faith. I had to just take the medicine, whether I was afraid of it or not, because I didn't want to get any sicker. And it had its complications, but I regulated it. But what I did do was change doctors. And once I did that, my health improved because I had a doctor that was concerned about me. If I said that I felt like I was having side effects, he adjusted the medication. So it's important that you have a good connection with your doctor, that you make your visits regularly. And if your doctor is not on the same page as you or with you on your journey, your treatment, you can fire him. You don't have to keep him.
There you go.
And then the mental issue happens for, I think, women over 50 in particular. You know, you feel a little isolated, a little alone. If you're not connected with a group of other women, if you don't have support, if you're not looking to join other networks of women that are maybe living with HIV or are in the field and can talk to you about what you're going through. Sometimes if you're isolated, you feel like you're just going through this by yourself.
Right.
So there's that. And for me, it was getting connected with a church home and having a spiritual connection and this spiritual support. I'm the only out positive person in my church. I say I'm HIV positive because I want to let people know that you can live a healthy lifestyle. Medication is effective. It's like the doctor mentioned, you know, you can live longer or just as long as someone with other illnesses or chronic illness like diabetes or whatever, if you take your medicines and you take them on time and regularly. But I purposely sat in my choir for a year and never mentioned I had HIV. I sang with them when I danced with them. And then they did a PSA on me and they put me up on the screen. So this big face came on the screen and said, "Hello, everyone. I'm Denise. I'm HIV positive." And everybody in the choir went, "Huh?" You know. But it was okay because what they determined or what they realized was I sang with you for a whole year. You didn't contract HIV. So it must be okay to be in my company. And I'm good there, you know.
Well, thank you for sharing that.
Thank you.
And you look fabulous.
Oh, thank you. Thank you.
Definitely fabulous.
Thank you.
So, Kim, as we said earlier, you were infected with HIV at birth or before birth. And as someone who's lived with HIV your entire life and now works to educate young women of color about HIV prevention, what do you want to contribute to this? And what do you want to tell them?
That it's okay. That it's okay to talk about what you're going through. It's okay to talk about HIV. That it's okay to talk about just regular things. We kind of miss out with regular conversations when we get around each other, and especially the youth in our area.
Now she she just touched on it. Regular conversations. If that's something that you're interested in, be sure to leave some questions down in the comment section and let's have a conversation.
We kind of surface glide and surface talk about different things, but don't really talk about the issues that is going on in our lives. And it's still scary in 2017 to tell somebody that you are HIV positive, or even the fact that you have chlamydia. That's still scary because people aren't comfortable with just having a normal conversation. When growing up with HIV, it was something that I was terrified to tell anybody about. And it was mainly because that's how I was raised up, was to not tell anybody that you have HIV, because back in 1993, 92, growing up, people were getting kicked out of schools. People, it was spreading around the neighborhoods. And then everybody was getting ostracized just because of that one person that might be in your family who is HIV positive. So I
Let me know in the comments. I'm kind of curious about something. How would you, how do you think you would react knowing that your kid is going to school or befriended someone with HIV or AIDS? How do you think you would react to a situation like that? Or if you sang in a choir next to someone and you didn't know and they had that illness? Be honest in the comments.
was always told, don't tell anybody because of that. And that kind of like trickled on and rolled on as the years kept going, where it was still scary to talk about HIV. And I just want people to know that it's okay to talk about sexual health and sexual needs that is going on. And it just doesn't have to be sexual, like people hear the word sexual health and they kind of just focus on that first word is sex. And it's so deep, much deeper than what you think of when it's sex. Like, let's talk about our bodies. Let's talk about anatomy. Let's talk about hygiene. Let's talk about, how I'm feeling. And these are just basic conversations that we just don't talk about. And where I talk to my youth about is, let's talk about what is a healthy relationship. Let's put HIV to the side, but let's talk about what it is just to have a, how you doing? Is this too aggressive? Am I being passive? Like, so just having regular conversations and actually putting labels to what we talk about is something that I think, we need to keep doing, and is why I keep doing what I'm doing.
Yes.
So I should also mention that Kim is the mother of a fabulous young man and the wife, and also facilitates a leadership training program with young women.
Nice.
So it is really a pleasure to have you as a part of this process to share your experience.
Thank you for having me. Like, just being a part of the panel, being a part of the organization, it keeps me motivated to keep doing what I'm doing, because it's something that you see just in your community that it's people are screaming out, and they don't know that they're screaming out that they need this information, that we need this going on.
Right.
I can understand being married to a partner that has HIV, especially if they caught the illness before you, even, during birth or something like that. But I'm wondering, how is bringing a life into the world, how is that possible if she has it, and he doesn't? I mean, they didn't explain that he doesn't, but I'm going to assume he doesn't. I mean, do they need to go to a hospital? Can they, still do the intercourse without a doctor around? I mean, if someone in the comments know, please paint me a picture.
So it's just a pleasure to be a part of a panel like this and have this conversation right now.
Well, good. And we still hear so much about the role of stigma and what it plays in talking about HIV and AIDS. What exactly, from your perspective, is stigma, and what are some of the unique ways in which it impacts and affects Black women, and particularly Black women of a certain age? Doctor, do you want to chime in? And
Sure. So I think with stigma, there's several different types of stigma that people can really experience from different aspects of their lives. There can be interpersonal stigma, which they experience from friends, from family, who really kind of very actively reject them because of their status, who may, say things that are very mean, discriminatory to them, exclude them. and it really results in a lot of social isolation and shame that they may feel around their diagnosis. People can also experience stigma from the institutions that they interface with. So that can include, for example, hospitals, going to the doctor and knowing that, you may not feel comfortable with that person because they're treating you a certain way because you have HIV. Or even before you even see the doctor, approaching the people at the front desk and feeling as though, because they know your status, that they're treating you a certain way or asking you very inappropriate questions about your health that really they shouldn't be asking. Or even individuals who may interface with other institutions like public housing, for example, for people who are specifically living with HIV and having to interface with that and feeling a lot of discrimination from the systems that they interface with when those institutions are aware of their status and know that about them and don't really treat them in a very positive, encouraging way. So I think people can experience stigma in these ways, and it can really manifest as shame. People can develop anxieties and depressions around it. They can really socially isolate themselves, feel very disempowered. And in some cases, it can result from, exclusion from the family, people being thrown out of their homes, people being cut off from economic ties, very important ties that are needed to maintain their health from their families if families reject them. And that's a huge issue that we see with youth who are both gay and also living with HIV, is that families will often reject them and they end up homeless. And in that case, they really struggle with that. But I think for women in particular, the issue of stigma can be very, very strong because it really kind of influences how it is that women can navigate their sexual relationships and make it more difficult to really kind of have open and honest conversations with their partners about their status, but also with themselves. So that's something that I've experienced as a provider in terms of what patients have shared with me about their experience in living with stigma.
Yeah, there's always someone in the family. It was my Aunt Evelyn. So it's like I told my mother that I was positive. My brother's positive, and my cousin is positive. One of my first cousins. So everybody doesn't share in the family because Aunt Evelyn is like the town crier. She'll tell everybody, and and she might not. She doesn't have a filter, so she won't tell it in the way it should be told.
Right.
So when I found out I was positive, I told my mom. I said, I'm going to go out in the world and I'm going to be talking about it. And if Aunt Evelyn finds out, she's going to find out on her own. I'm not going to tell Aunt Evelyn, but because my mother, in the beginning, my mother was uneducated, and she initially would separate my brother's plate, fork, knife, and those things, because she grew up in the era of typhoid. So for her, any infectious disease was highly contagious, and she was frightened of it. But I educated myself, and I helped her to understand that that's not the way it's contracted. You can't get it from utensils or whatever. And then that was not an issue. My mother embraced us all. But the fact is that there's always someone in the family that you don't know and can't share, and they want to talk to you. They want the family to embrace.
The best way to be a part of this family is by giving this video a like and also subscribe to the channel.
They want to be able to share their isolation or their loneliness around the illness, because it is you can isolate around it, but because of the reactions that they get being put out of homes, and I know someone that got put out of their home, and the things that happen, it's a negative prejudice that people have towards, a negative attitude for lack of knowledge towards HIV positive people. And it was so prominent that Balm and Gilead did a campaign called Can Love Conquer Stigma? It's important that we keep the conversation open about it, because stigma is a powerful thing. It affects people negatively, and it can definitely affect how we move through our journey, whether we are successful in our treatment or not successful. Sometimes it depends on the support that we get. And if we're shunned or pushed aside because of our status, it's hard. It's a hard road.
So I would imagine that in the work that you do in educating and going around communities and in particular talking to women, more seasoned individual women, that the whole idea of talking about sex, talking about sexuality, HIV status, even the notion of having sex at over 50, like as if that doesn't exist, can raise a lot of feelings that people are going to look at them or view them in a certain sort of way. What's been your experience when you've gone out and educated at the senior centers or in housing or in the many places that you go?
It's been a mixed reaction. Like some senior centers, they're very feisty and lively, and they're very interested in knowing about safer sex. When I had female condoms, one lady said, "How do you put it on?" And I had to give her an on-the-spot demonstration on how to use the female condom, and she took it with her. Depending on the locale and the group of people, if they're enlightened group of people and maybe have heard other educators come, they're open to it. But some organizations, churches in particular, even though I have a progressive thinking pastor and he's very open about letting us put condoms out and talk, there's the old guard that's there. And they are, they don't want to hear it. They don't want to, they don't want to touch the literature. They think they can get HIV from touching the literature. They don't want to touch the condoms or whatever. But when I have a safer sex workshop, it's all giggles and fun. And they, and they'll come. I had to do it off campus. I couldn't do a workshop in the church on safer sex because people were embarrassed about it. So I took it off campus, and I got a couple of people, and they said, "When are you going to do that workshop again?" But the other thing is, if you're a child of the 50s like myself, you've never seen a condom. I didn't know anything about condoms. And it wasn't until, and then you go into the 60s, and when I was engaging in sex in the 60s, like 67, 68, I still didn't see a condom because it was free love. And it was the era of free love. And so if it's not something you grew up knowing, if it's not something that's talked about, if you don't know your anatomy, like you said, if you don't even know, if you call your vagina a kitty or a poo-poo, then you're not going to be able to negotiate for safer sex. Right. And I think it has something to do with the way we were brought up. There wasn't sex education in school for me when I was growing up. Yeah. So if I'm, in my time, I had to play catch up in order to learn about safer sex, and I'm sure that that's the issue for a lot of women over 50.
And I think just to add to that, older women who have children, it's often very difficult for them to then talk to their children about sex as well, and their bodies and how to care for themselves. I remember my mom saying to me, even when I started my period, like, "Mom, what does this mean?" She's like, "Well, it just means you need to keep your legs closed and your dress down." And that was her sex education. And that was that. But really, that did not equip me at all for what I was to face kind of as a woman of color, really navigating sexual relationships as an adolescent and even into my 20s. And so I feel like it's really important for women also to start those conversations with their girls and their boys. And if they're uncomfortable with that, there's a whole, resources in the community that they can tap to do that for them, like talking to your pediatrician or your doctors or, community advocates or educators, that kind of thing. If they don't feel like it's something that they can do themselves or that they don't have a lot of information to share with their children.
Tell me in the comments, what did your parents say to you in regards to having that type of conversation? We understand the whole use condoms or use protection, but other than that, what are other things that they told you?
So that's also very important.
Kim, what do you see as the issue around stigma and women?
I think again, it's the whole part of when growing up with HIV, I saw a lot of my friends who are no longer here right now, and everything that they went through based off of basically every part of stigma that you was talking about. I was like, I didn't face it, or my friends faced it growing up, because it was different when we grew up in an era when HIV first came out, and like you said, it's something that institutionalized. We don't, the doctors who were scared to touch you, or just remembering when my mom, she passed away, and they had me in like a whole garb of like wrapping. It was just like I had the face mask. It was like some plastic thing covering me with like three gloves like wrapped around. And I didn't know that I had it, but that's just basically how I kept it in my mind, is how it should be. And that's how I normalize it for myself, is that everybody should be scared, because it's something that you're going to get just by breathing breathing my air.
Right.
And because that's how it was perceived, it kept going on. And just being in high school, where you hear they might say something about HIV, and then everybody's calling it the monster. Now, I don't call it that anymore, but that was my era, where if you have the monster, you just joking, or she got the monster, you look like you have the monster, and nobody corrected it. Nobody said anything. And this kept going on, where that just fueled basically this whole thing with stigma, where, when you want to disclose to somebody, you can't, because you scared that somebody's going to punch you in the face just by saying that you have HIV, which was my problem, because my friend told somebody, and she got punched in the face. I'm like, well, I ain't telling nobody. Like, if that's what's going to happen, I'm going to be fighting. I'm not doing that. Or just basically, like, growing up in a spiritual household, and, not having that conversation, just like you said. My grandma said, close your legs. You come in here, don't be coming here with no babies. And it was like, okay, I won't be worried about that. So it was just these lack of conversations, and normalizing HIV was something that it didn't exist. So it just fueled on a fire with the stigma, with going to the doctor, and, I remember a case where I went to the dentist, and nobody wanted to work with me. And they were all like, I'm already waiting because I'm at Kings County. So I'm waiting there for 3 hours. By the time I get there and I'm seated and they see that I have HIV, it's like, oh, I'm not working with her. And I hear everything. And then all that's doing is putting into me where I don't want to do anything now. I don't want to get any work, because now I'm scared of how you're going to treat me. And I'm looking at myself where, am I even worthy? Why am I coming here? Why am I even trying to get treated? And that's why a lot of my friends, they're no longer here, because it's just how, people, they talk and you whisper, and you're like, are they talking about me? Oh, I'm not even going to deal with that. I don't even want to come to care. And then it started affecting you as a person as a whole, where you don't even want to do anything for yourself. So this whole thing wraps up where nobody's talking. So that's why I'm happy we're having this conversation. So that way we can talk about this.
Absolutely.
Absolutely. And thank you for both sharing your perspectives on this and sharing your stories. So in that,
Deep down, come on, we all know that this is a touchy subject for many people, but do you think that many people should have this conversation, or do you think we should just, turn our back on and walk away from it?
thinking about that, what more should we be doing to support HIV prevention, treatment, and care for Black women and girls? Any ideas?
Well, I definitely feel like, kind of what we're doing here, which is starting a conversation. That's number one, is to be able to really have an honest conversation about your risk, your sexual behaviors, really be able to talk to your doctor about that, as well as your partner about their behaviors as well, and knowing your partner's status and vice versa. I always encourage young people in particular, and some of the people I see who are initiating new relationships, to really kind of start on a note where the person's status to start. If it's difficult to before you get too far along in the relationship, where it might be difficult to disclose or that kind of thing, really kind of getting tested on a routine basis, so that it's not something that's so stigmatizing to go and have a test. Also, for people, again, to know about the HIV prevention pill as a way to kind of prevent HIV for women. We know that the HIV prevention pill is very effective. It's really important, however, for women to take it every single day, because we know that the pill, works differently in women's bodies than it does in men's bodies. So those are some things that are, I think, really important to take home.
And what would you like to see, Kim?
I think we should start with, in the terms of prevention, I always say, look at your body first. Before, nobody should be telling you what's going on with your body before you know what's going on with your body. My grandma always told me, you can smell yourself before anybody else does. So
That's
go take a shower.
True.
So I always say, and I tell this to my son, and he's 7, and I say this to my girls that I teach, that look at yourself. My son, I told him, based on somebody who's 7, since he was like 2, I'm like, okay, this is called a penis. So if it hurts, somebody touches you, this is what this is. So I'm building that conversation up with my son as he gets older. But with my girls and just my friends, I always say, look at yourself, get a mirror, open your legs, look and see what's going on. Know your smell, know your body. So that way, when you want to have a conversation with somebody, you know what you're talking about when it comes to you. That way you go get tested. If you don't feel that you're, doing anything right now, go get tested. If you don't feel you at risk and you're not doing any of the things that you said and coming in contact with the bodily fluids, then go just do a test run. Go get tested, see how it feels. So that way, you and your partner, you can tell your partner, this is how it feels to go get tested. These are some places that I've been to, Let's break this ice when it comes to that, taking the medication if you are positive. And even if you're not and you want to get on PrEP, it's just certain things that I feel that people should do that would help this whole situation where we won't be having this conversation in 10, 15 years. So I would really hope that. I could be doing something else. I could be teaching. And not about HIV. This is something in the past. Kind of like what, the history books are telling us, what is that? And that's pretty much what the mentality is right now when it comes to HIV. When I'm going out to these schools and they're like, HIV, that was something that I heard like years ago. It doesn't exist. And I'm like, no, it's still here. This is what's going on. This is how you have to watch out. So it's that lack of communication, lack of people getting tested, knowing how to put on a condom, knowing that you can get condoms for free. People are so scared to put in a condom because it's like, oh, I'm not going to feel it. Well, do you want to feel HIV? Because going to the doctor every 3 to 4 months isn't fun. Having them taking 10 to 14 vials of blood and having to tell your doctor, the nutritionist, your therapist, every nook and cranny of what is going on. So I think just educating the things that we're doing now with, having the positive speakers telling their life stories is something that it's important. So,
Denise?
My hope is that women will unite and be a little more supportive of one another. I think part of our issue is that we can be at times cliquish, cloddish, clannish, and not want to unite around a specific issue. I believe that even though I'm over in AIDS ministry, that when the cancer walk is happening, I should be supportive of that cancer walk, or join in, conversations other than, Housewives of Atlanta or something like that. To actually have, maybe little networks, of women that open up the discussion, because a lot of the stigma or the lack of use of condoms comes from being in relationships where you don't feel you can negotiate. And those conversations have to happen for people to help them negotiate for condom usage and know that you're good, you just as you are, that if that person is interested in you, these are some of the things that you can do to protect yourself. Those conversations have to keep happening and not just stop at the fact that you've taught a bunch of people, but you have to keep the conversation open and continuing. And I think that women need to get involved in research. However, researchers need to be a little more compassionate towards women. They have to understand that, yes, we're taking an unknown medication, but we're not test monkeys. We are women, and we want to have these medicines work on us in a proper way, not have abnormalities based on the fact that it's not meant for women's bodies, or it doesn't work in conjunction with our chemistry. I was a part of a clinical trial. It was successful. I was cleared of Hep C. I was in the Havadi.
Congratulations.
Thank you. It was
Congratulations.
helpful to me. But I have to say, it wasn't the most pleasant experience because the researchers didn't have the right attitude. So we still have pockets of medical professionals that need to be educated around sensitivity towards women when it comes to treatment, because we're not always in the mood to be poked and prodded, or we're sensitive to that. And you have to be sensitive to our issues and our needs as women. Yeah.
Definitely, definitely. So let me just ask you, ladies, for our audience, what would be the take-home message? What would you want to leave the audience with a charge? What would you want them to do? Kim, you want to start?
Okay. I think the biggest thing for me is knowing your status, and it's not just for anybody else. It's for you. Living with HIV it's livable. It's manageable. You can do it. I'm living proof. 30 years.
Yes.
Married. I have a healthy son. Both of them are HIV negative. They don't have it, but it's that conversation that I had to have with my husband. The conversation that my grandma had to have with me shouldn't be a conversation that people are having with each other. And I think just knowing your status and getting tested and having this information and, just doing right by you, because you only have one body. You have this body for the rest of your life, and you have to take care of this body. Nobody else is going to do this for you. So take care of it. Go get tested. Know what's going on. And that just doesn't have to be with HIV. It has to do with everything, what's going on as women, as humans, as just African American, when we're so at risk for different things that we don't talk about. So going to get tested and going to the doctor, honestly, is what we need to do.
And we should say that now testing is so easy. You can, within 20 minutes, get your results, and it can be nothing more than a swab. We don't have to resort to drawing blood the first go round. So technology has come a long way. And now you can go to the Department of Health, you can get your primary care physician to test you, or you can find one of the health fairs at one of our houses of worship and go in and get a free test from a mobile van. Most definitely. Denise?
Yeah, I'm in conjunction with Kim in as much as, like for me, I think what happened with me is that I gave over my self to someone and expected them to take better care of me than I could take care of myself. I gave them all the responsibility for my care and well-being, and don't do that.
Don't do
that. Like
do
Diddy
that.
said, don't do that, because the fact of the matter is, no one can treat you better than yourself. No one should be expected to take better care of you than you can for yourself. You are worth it. Protect yourself, know your status. And if you're tested and you test positive, know that the treatment is excellent. You can get support, you can get help. Don't feel like it's a death sentence, because it's not. It's a manageable illness with medication and treatment works. So I think that I think a lot of times, for me, I was in love with this person. I felt like they were the best thing since sliced bread. They were in the field with me. They couldn't possibly be that way. But you don't know. You don't know. And to not practice safe sex on a consistent basis and just be sporadic about it because you're in love is, like they say, love is not a condom, or, you just can't protect yourself with love. But you can be in love and be positive, and you can be in love and stay negative.
Right.
Just care for yourself. Yeah.
Right. I think for me it would be doing more conversations, being able to gather the women in my family, gather my friends, and just have honest conversations about sex, sexuality. There's something, and as hard as that conversation is sometimes, it's sometimes even bringing somebody in from the outside that can facilitate some games and ways in which we can just start really talking to one another. Because there are so many wonderful things that happen to us through the course of our lifespan. I just wish they weren't all secrets. Like,
Yes, that's exactly.
you hit an age and it's like a secret. So communication for me about just taking the time to just sit down and talk to one another, whether it's with your girlfriends, your family members, but really being able to have honest conversations.
Definitely.
Even in our houses of worship, even being able to say the word sex and sexuality and HIV all in the same sentence, so that in our communities we can really begin to address the stigma.
You mentioned house of worship. I just have to say that when people try to beat you over the head with the word of God in the house of worship, know the word for yourself. Because a lot of times people use the scripture out of context to condemn, to judge, to stimulate conversation around sex and sexuality that isn't in the word. It's not the way the word is interpreted. So just know the word for yourself and not rely on other people's interpretation of it, because it's not always, that'll have you running out the doors of the church when actually that's a good support system to be spiritually connected.
Do you have anything you want to leave our audience with?
I mean, I feel like you ladies pretty much summed it all up, which is great. Just to echo what you said, definitely the sharing of information and experiences among women of color, so that we can kind of grow closer to one another as a community and really lift one another up, particularly in really difficult times, in issues of health, and issues of sexuality. I feel like, especially for older women, they have, so much knowledge to share with the younger generations. And I feel like, it's really important to start to kind of open up, those conversations, dispel myths and stigmas. And it kind of really starts with that open and honest conversation. So, and also just to echo what you said as well, I mean, the treatments for HIV are excellent. They're not without fault, but in many cases people do very, very well with little or no side effects from the medications that are prescribed. There are research studies going on now that are investigating for cures for HIV. We're also doing research trials to look for alternative methods to administer medications to people other than through taking pills, which is going to be fabulous for some patients who really have difficulty swallowing pills. So, the research continues. We continue to try to kind of push this forward so we really can truly end the epidemic of HIV in our lifetime. And I believe that's possible.
Yeah, I do.
I do too.
Yeah.
I do.
So,
Yeah, definitely.
well, ladies, it's really been an honor and a privilege. And we are really very grateful for the time that you have come with us today and shared your journeys. The time has gone by so quickly. I feel like we've just sort of started. I'd like to thank my guests today, Kim Kennedy, Denise Drayton, and Dr. Leggett, for joining me today for today's program. We hope that you and our viewers find today's topic to be informative, really. For information about the mission and the work of ACREA, please visit our website at www.acrea.org for information about HIV and older adults. And to view all of Ms. Warwick's PSAs, the 3 that are currently up, please visit ageisnotacondom.org, where you will find a ton of information about being over 50. You'll also find us on Facebook, Twitter, Instagram, for those that are technology savvy. And on behalf of ACREA, I express my sincere thanks to Manhattan Neighborhood Network, whose programming enriches all of our lives by presenting us with information that addresses the critical issues that affect us as New Yorkers. We hope that you enjoy today's programming and that you'll share its important information with your families, your friends, and your neighbors. Ladies, I can't tell you, it's been an honor. It's been a privilege. I thank you for taking the time, and I thank you mostly for sharing your stories. I know it's never easy to be able to say all that you said. So thank you. I'm your host, Deborah Levine. Thank you for watching. I'll see you again soon right here on Manhattan Neighborhood Network.
Well, let me be honest with you. I know that this is a touchy subject, like I mentioned once before. This video was very educational, and I hope you gained something from watching it. But as always, don't forget to like, share, watch more videos, and subscribe to the channel.